NFL players that almost died. NFL players put their bodies on the line in pursuit of a championship each and every year, playing through injuries that would sideline most other athletes. However, not every NFL player makes it to the end of each game unscathed. There have been times throughout history where we've seen professional football players suffer life-threatening injuries on the field. From broken necks to cardiac arrests, these are some of the most horrific events ever witnessed during a sporting event. In this video, we'll take a look at some of these harrowing moments and explore what happened to those NFL players that almost died while playing professional football. Nothing can truly capture the same intensity as these stories straight from the people who experienced them firsthand. But reading about such things serves as a vivid reminder to appreciate your favorite team or athlete more so when they battle out for glory against real-life odds. Discussing medical advancements made in the NFL since then to prevent similar accidents from occurring. When it comes to medical advancements in the NFL, the progress made over the years is truly remarkable. Thanks to cutting-edge technology and state-of-the-art equipment, medical professionals are now able to spot potential injuries before they even happen. And if someone does get hurt, they can receive top-notch care that greatly reduces their risk of long-term complications. From improved helmets to advanced diagnostic tools, the NFL is leaving no stone unturned in their quest to protect their players. It's an exciting time to be a football fan, knowing that our favorite athletes are not only being cheered on by millions, but also being expertly cared for. With each passing year, we can only look forward to further advances that help prevent injuries and keep our players safe on the field. Top 10 craziest NFL players that almost died. 1. Ryan Shazier, a former linebacker for the Pittsburgh Steelers, suffered a spinal cord injury in 2017 that left him temporarily paralyzed and unable to move his legs. After being taken off the field on a stretcher, an MRI scan revealed that he had suffered a severe spinal cord contusion that required immediate medical intervention. Fortunately, following extensive surgery and physical therapy within the following year, he was able to make a miraculous recovery and even returned to college football as an analyst in 2018. 2. Tom Brady, quarterback for the New England Patriots since 2000, faced one of his most challenging moments as an athlete during a 2008 game against the Kansas City Chiefs. While attempting to avoid a tackle from two players at once, Brady's leg got caught up in their tackles and resulted in an ACL tear, which caused him to miss the majority of that season's games. Despite this setback, Brady made a full recovery with help from physical therapy and dedication to rehabilitation exercises over time, before returning back to playing football again the following year. 3. DeAndre Hopkins, wide receiver for the Houston Texans since 2013, experienced an especially tragic moment when he was blindsided by two defenders while being tackled during a 2016 game against the Jacksonville Jaguars, resulting in a fractured right hand that required season-ending surgery immediately afterwards. Fortunately, with careful medical attention, including pins and plates inserted into his hand area, along with intensive physical therapy treatments, Hopkins was able to make a full recovery by the next season, allowing him to return back onto the field stronger than ever before. 4. Adrian Peterson, running back for the Minnesota Vikings since 2007, suffered from multiple knee injuries over time, which caused him to miss several games throughout his career due to surgery or rehabilitation necessities, such as ligament reconstruction or microfracture surgeries, depending on what specific injuries needed treatment at any given time frame. Despite these hardships though, Peterson has been resilient enough over his career that he has managed to beat all odds and come back onto the field each time ready to play, no matter what kind of pain or discomfort he may be experiencing due to past injuries still healing up. 5. Odell Beckham Jr., wide receiver for the Cleveland Browns since 2019, was tackled heavily during one particular game in 2014, resulting in an ACL tear, requiring reconstructive surgery within weeks after it happened. This tragic incident did not stop Beckham though, as he worked hard at rehabilitation exercises combined with physical therapy sessions until eventually returning back onto the field, almost completely healed up within 9 months of his injury. Although it took some time, Beckham eventually did make it back onto cleats and gloves, ready to play football like never before. 6. Alex Smith, former quarterback for the Washington Redskins, almost died after suffering a severe leg injury during a game in 2018. He was rushed to the hospital with an infection in his leg, which had developed as a result of compound fractures and tissue damage caused by the tackle. After emergency surgery, doctors worked quickly to remove infected skin and tissue from around the fracture site to prevent further complications. Miraculously, Smith was able to make a full recovery and even return to playing football within 1 year of his injury. 7. Bo Jackson, a former running back for the Los Angeles Raiders, nearly died in 1991 after being tackled by 2 separate players during a game. This violent collision caused him to suffer severe hip trauma, including tears in both femoral arteries, which caused massive internal bleeding that threatened his life. Fortunately, Jackson recovered fully thanks to emergency surgery and months of intensive physical rehabilitation that allowed him to regain strength and movement in his hip area. 8. Carson Palmer, quarterback for the Arizona Cardinals since 2013, almost died in 2006 when he was tackled by 2 players at once during a game against the San Diego Chargers. The result was a gruesome dislocation of his left elbow, which tore cartilage and ligaments in his arm, causing massive blood loss and an extreme risk of infection or paralysis. After undergoing immediate surgery to save his arm, Palmer would need months of physical therapy to regain full range of motion before eventually taking the field again. 9. Joe Theismann, former quarterback for the Washington Redskins from 1974 to 1985, suffered a severe leg fracture during a Monday Night Football game in 1985 as he was sacked by Lawrence Taylor during the second quarter of play. This injury caused him to suffer 2 broken tibia and fibula bones in his right leg, which could have potentially resulted in amputation if not treated properly. Fortunately, with swift medical attention and multiple surgeries over time, as well as intense rehabilitation techniques, he was able to make a miraculous recovery and even returned to playing football 1 more season before retiring shortly thereafter. 10. Troy Aikman, former quarterback for the Dallas Cowboys from 1989 to 2000, almost died during the first week of preseason practice in 1993 when he collided with another player on the field, resulting in him losing consciousness due to internal bleeding from a tear in one of his large arteries near his heart area, requiring immediate medical attention upon being taken off the field. After being rushed into surgery, then followed up with extensive rehabilitation exercises over time, Aikman eventually recovered fully, allowing him to play successfully for many years after that incident had occurred. Explain the importance of preventive measures for players' health and well-being. As we all know, sports brings happiness and excitement to everyone, no matter what age you are. However, while playing games, one must not forget to prioritize safety and well-being. Preventive measures are crucial for players to avoid injuries and ensure that they can continue playing their favorite sport for a long time. These measures include proper warm-up exercises, wearing the right kind of protective equipment, maintaining a healthy diet, and getting sufficient rest. Moreover, coaches and trainers must be knowledgeable about the most common injuries in their respective sports and implement necessary safety protocols to avoid them. As players, we must understand the importance of taking care of our body to be able to enjoy sports to the fullest. With proper care and preventive measures, we can maintain good health and continue playing sports for years to come. In conclusion, it is important to note what a miraculous turnaround the game of football has had, thanks to the medical advancements that have been made in protecting players. Where death seemed like such a looming possibility before, now we can be much more sure that on-field fatalities are unlikely. But it's also of the utmost importance for the players to make safety a priority by properly training for each match and caring for the bodies both during and after play. It goes without saying then that surgeries and treatments must be done with great care as well. Those types of injuries require extra time and attention due to their severity. When all these measures are taken, player safety becomes a larger possibility, which we as spectators obviously desire for all those involved in professional NFL sports. With our current knowledge, who knows how far the game could go from here? If you like NFL videos, subscribe below and hit the like button. We'll see you in the next video.